We begin tonight with two members of the United States Senate at the heart of the fight for health care reform. Senator Orrin Hatch is a Utah Republican and a member of the Finance Committee. Senator, you're one of the coalition of the willing, so-called, one of the 7 senators, 4 Republicans and 3 Democrats who may well decide this health care bill. What will it take to get it into a conference with the House?
Well, as you know, both the House bill and the Health Committee bill in the Senate were very, very partisan bills. So it would take a real bipartisan effort to try and get something that I think everybody could support. And there's a wide disparity of what we should do. And almost everybody is for improving access, reducing costs, promoting prevention. But when you get into the details, that's where you get into trouble. And, of course, we're finding that they're pushing government mandates. Those are job killers. Government plan, in other words, the government control of health care and Medicaid expansion. These are all very, very difficult issues that have to be examined or we'll put this country on its backside.
Well, let's listen for a second, Senator, to President Obama. Here's what he said today.
I know that there are those in this town who openly declare their intention to block reform. It's a familiar Washington script that we've seen many times before. These opponents of reform would rather score political points than offer relief to Americans who've seen premiums double and costs grow 3 times faster than wages. They would maintain a system that works for the insurance and the drug companies while becoming increasingly unaffordable for families and for businesses.
Is that helpful, Senator?
Well, I like the president. He's a very fascinating and interesting man, a very bright guy, charismatic, good speaker and all that. But let me tell you something. He hasn't rolled up his sleeves and gotten involved in this thing, and that just sounds like criticism that is general in nature but really doesn't hit what's really going on here. Look, we're worried about having the government take over health care in this country. And if anybody believes that the government's going to do a better job in the private sector, they got to be nuts. Look at Medicare. Medicare is now facing a $39 trillion unfunded debt, and that's because government's running it. Medicaid, look, they're talking about Medicaid expansion. If we go with either the House bill or the Health Committee and the Senate's bill, my gosh, you're talking about moving all kinds of people into Medicaid, which would destroy the private competitive market. And not only that, but in the end, you wouldn't be able to cover the 47 million people they claim have to be covered. The fact of the matter is that there would be about 33 million not covered if you take the Health Committee plan without moving them into Medicaid. If you move them into Medicaid, you'd still have 15 to 20 million people who would not be covered. To be honest with you, we need to work in a bipartisan way. This is 1/6 of the American economy, and all we're hearing from the president is more taxes, more government, more spending, and more budgetary deficits. And that's why when the Budget Committee chairman, Doug Elmendorf, who was appointed by Democrats, by the way, and who's a terrific guy, very honest, when he came out and said, look, all you're going to do is add more to the deficit, you're going to have more spending, and in the end, you're not going to do as much as you're doing now. I mean, in all honesty, we've got to work together in a bipartisan way if we're going to solve 1/6 of the American economy's problems.
If you're going to get a lot of young people and healthy people to join this healthcare system, and I'm for it myself, I mean, my kids should join. They're in their 20s, 2 of them are. If they would join, they'd be healthy and young, and they'd be a good bet for a healthcare system. What about tying that together with something like you have on the Hill, a credit union, something that it's a cooperative without a lot of, it would have full transparency. You go into it, it'd be a shared risk, a lot of healthy people in it. It might be a good deal, in fact, for everybody. What about that kind of a cooperative as a compromise between no public option and a public option?
Well, Senator Conrad from North Dakota has come up with this co-op approach. It's much easier spoken of in generalities than it is in putting it into practice. But the Democrats are insisting that there has to be what they call a public option or a government-run health care system. And they may be willing to go with something like co-ops, but Senator Schumer, who seems to have a lot of control in the Democratic side, indicated that from New York, he indicated that he would not go along with it unless, and he's speaking for the liberal Democrats as a whole, they would not go along with that unless there was a federal co-op plan run right here in Washington He said the Democrats would agree to appointing the board, giving them the money, and letting them be on their own. Now, if anybody believes that, they got to be nuts, is all I can say. I mean, that's what they want to do, and let's just be brutally frank about it, they want to come up with a system that pushes you towards a single-payer system. Single-payer means that the government decides everything. Now, like I say, we see how the government has fouled up Medicare, Medicaid, with the debts and the debt structure and the unfunded liabilities. If you think government's going to do it, my gosh, you haven't looked at the past.
Okay, Senator, thanks for coming on. Can you throw me a bone by saying that you're headed towards voting for Sotomayor for the Supreme Court?
Well, I'm still undecided. Literally, it's one of the most difficult problems I've had because I want to be fair. I like her very much. I like her family. She has a great life story, but I got to admit there are a lot of troubling things about her testimony that have really bothered me. So I'll have to make up my mind by next Tuesday, and I'm reading the cases. I'm doing everything I can to be fair. I want to be fair, but on the other hand, I got to say there are a lot of things that bother me.
Okay, thank you very much, Senator Orrin Hatch of Utah. Joining us now, North Dakota's Democratic Senator Ken Conrad, who's the Budget Committee chairman and, of course, a member of the Finance Committee itself. I was asking just a moment ago, I was asking Senator Hatch, a Republican, about the idea of having some kind of a co-op or a credit union model like you have on the Hill for all the employees on the Hill. I used to be a member of that, the credit union, where everybody kicks in and you get a lot of young people involved in it, so it's a healthy business. How do you flesh out that option, sir?
We've been doing a lot of discussion about that. I think it's developing in a very comprehensive way, that you have a cooperative approach, so it's not government-run, government-controlled, it's membership-run, membership-controlled, just as you described with the credit union here on the Hill. So I think it is very much a live option. We see Group Health out in Washington working very well, 600,000 people performing extremely well in an unreformed insurance market. And what the experts have been telling us the last 2 days, in a reform market, those cooperative models could even be more effective.
Well, let's talk about the other piece that seems to be the problem, the general financing, the plugging of the hole, if you will, fiscally here. Have you found the $200 billion?
We've got a number of pieces that could completely fill that hole. This afternoon has largely been dedicated to an analysis of those various options. We have had today some of the leading actuaries in the country helping us analyze these options, as well as the Joint Committee on Taxation. I think it's been an outstanding day. I think we're getting quite close now to a comprehensive agreement.
When does the schedule look like it's going to reach fruition? Do you think you might have a deal by tonight, late tonight?
We have said all along that we can't impose these kind of artificial deadlines. We'll be ready when we're ready. So much of this is out of our hands because we come up with options. They go to the Congressional Budget Office for analysis and scoring, and we don't know when they will come back with an answer, just like we don't know when joint tax will come back. We keep sending them variations to try to meet concerns that members have, and we just have to let that process play out. What's most important here is not that we meet any specific deadline. It is that we get this right. We've got lots of time left in this year to pass meaningful health care reform. The critical test is, will it be right? Will it stand the test of history?
Is the president and are his people doing the right thing these days? Are they helpful to you in getting a deal?
Yes, the president had me down last Friday. I spent almost an hour with him. We had a very, I thought, constructive discussion about the options before us. I think they're doing a very good job of keeping the pressure on because, they're quite right. Work expands to fill the time, and if there's not somebody pressing to reach conclusion, you never do reach conclusion around here. So I think they're playing it about right, and I think they've been very constructive.
You've got 4 Republicans in the coalition of the willing, Senator Hatch, of course, Senator Grassley included, and Snowe included. How do you guarantee to them that whatever deal they go along with for the Senate version, that it will largely be protected in conference, that this won't be a bait and switch with the liberals in the House?
Well, that, Chris, is a great, great question, because that is very much on their minds, as you can imagine. And what they've been promised is a place at the table, that there will be a real conference committee, and they will be there. And they will be fully represented, and they'll have a chance to, just as they have throughout this process, contribute fully to the discussion and the debate.
You know, you're a great guy. I really appreciate it as an American, the work you guys are doing up there trying to get this finished. Thank you so much, Ken Conrad of North Dakota.